Yes.
Yeah.
So thank you very much, Dr. Kumar, for having me in your course. Can I have feed from my laptop, please? Yes. So I'll be discussing a case which presented like this. The case had corneal opacity and a little bit of anterior synechiae there. And you can see that the cataract is very dense and mature in this case. So I start off with the phacoemulsification, thinking that the size of the pupillary dilatation is adequate to finish off with the 1.8 millimeter phaco incision, which I routinely use. So I go ahead and start capsulorhexis. You can see a little bit of corticocapsular adhesions there. So just making a capsulorhexis, which is almost 4.5 millimeter in size. But as the capsulorhexis is progressing, I realize that the pupil has come down on me. So I decide that looking at the hardness of the cataract, it's not possible to go ahead, it's not safe. So I decide to use the Melian ring. So remember, this is the cartridge which I use to reuse the Melian ring. So this is the cartridge which comes with the micro incision lenses. So in the same way, the leading scrolls and the lateral scroll, they go in the cartridge. And you can see I'm pushing this Melian ring further. And now it's important that you put the OVD behind the pupillary margin and the anterior capsule, so that you don't catch the capsulorhexis margins while you are inserting the Melian ring. It's very important that in the first go you engage the leading scroll. So here the leading scroll goes and engage, and I'm very careful that I can see the stained anterior capsule here. So I know that yes, I am above the anterior capsule. I have not engaged the anterior capsule. So here I engage the leading scroll and using the Kugelens hook to guide the lateral scroll to engage the pupillary margin here. So once you have these three scrolls, you can use two instruments to engage the Melian ring. Now I realize that the size of the capsulorhexis is not adequate. So that's the importance of using the pupillary expander devices. So I decide to first enlarge the capsulorhexis so that I don't damage the capsulorhexis margin while doing phaco in this hard cataract. So now there's a drill and chop technique which I use. I drill in the center to weaken the endonuclear core. Drill more, and once I have drilled enough, I go ahead and do the phaco chop. You see the crack propagates all the way from anterior to posterior side and make further cracks in the nucleus to divide it into smaller pieces. And once you have 5 or 6 pieces, you can take these pieces like a piece of cake. So I go ahead and slowly I eat away all the nucleus, of course stopping with the viscoelastic in between, as you can see here, to protect the endothelium. And here comes the last pieces. So after taking out the nucleus, I put the IOL in the capsular bag, take off the Melian ring, disengaging all the scrolls one by one. And either you can use the same injector to take off the Melian ring, or you can just use the Kugelens hook or any forceps to pull the Melian ring out. So I just hold one of the scrolls here and it comes out. So that finishes my case. Thank you very much. So the take-home message, what I want to give everybody is to use these expander whenever you feel that it won't be safe to continue with the phaco without them, and to have adequate size of capsular access in these cases.
Very nice,
Thank you.
Harshul. I think that was a tough